Hi, folks. Thanks for being early or on time. We're going to get started here in just a couple of minutes, so hang tight. Thank you.
Angie, you just let me know when you're ready to go.
Now let's just give it another minute or so. Let people log in. Thanks for joining us, everyone. We're just about ready to get started. All right, Shasta, do you want to go ahead and kick us off?
Of course. So, good morning, everybody. Thank you for joining us for our second climate change, tribal climate change and health adaptation webinar. Today, I'm coming to you from beautiful Palm Springs, California, where yesterday it was a balmy 112 degrees. So it was nice to be out in the boiling, baking sun. I hope you're having beautiful weather wherever you are. And today we're going to be going over Climate Change and Health 101. And so some of this stuff is going to be things that you're very familiar with, and for some of you it might be a little bit new, but it's never a bad thing for us to go over the basics and refresh our memories or reinforce what we already know. For the most part today, it's going to be Angie giving our presentation, and then we have a guest speaker, Vanessa Crissy, and she's going to be coming on closer to the end of our hour together. Just like last time, you can ask questions in the question box. And if we have questions that people want to be able to talk about and participate verbally, we can unmute you at that time. So I think Angie's going to go over a little bit of that housekeeping stuff. So I'm just going to throw it over to her. And that's a painting behind my head, by the way. I am not underwater. So Angie, go ahead.
All right, hi everybody from around the country. Welcome back, and we really appreciate you coming for our second session. If you missed the first one, there is a recording available of the first one so you can catch up. It was an introductory webinar. We are going to have webinars every first and third Tuesday through December. So this is the first time we're really diving into some real curriculum and content. And today, like Shasta said, we're going to focus on setting a basic foundation of understanding on the topic of climate change and health. And so what is climate change? What is health? What do these topics have to do with each other? And what do they mean for tribes? Over the course of this webinar series, our goal is to help you feel prepared with knowledge, tools, and resources to conduct the work of climate and health adaptation. Last time we had almost 50 people attending our first webinar. They're from all over the country, so we're really happy to have participation together on this webinar, and we like it to be interactive because we'd like to learn with you. If you can look up on the right, you have a control panel, and just wanted to make sure, that for now it would be great if you can keep yourself muted. We will have opportunities for polls and group discussions, in which case we might unmute you and ask for your input. If you have other comments, there will be opportunity for comments and questions. Please use the chat box, and Shasta's going to help me monitor here to make sure we're not missing any comments or questions, and we'll get those addressed, okay? All right. So we already introduced ourselves, but just a quick reintroduction. So Dr. Shasta Gon is the environmental director for the Paul Abandoned Mission Indians and also the cultural preservation officer. And on the side, she's an anthropology professor, just for kicks. And I'm Angie Hacker. I'm going to be speaking the majority of today. I'm a co-owner of Prosper Sustainably, and I've been serving communities in sustainability, climate, and energy for over almost 20 years. We're joined today by Vanessa Crissy from the California Tribal Epidemiology Center, and we're really excited because she's going to bring to life some tribal health systems that can be really helpful for you in doing climate and health adaptation work. And so let's catch up a little from our last webinar. It was 2 weeks ago. Many more of you have filled out the assessment, so I just wanted to say thank you. That was a pre-assessment, so we can gauge your knowledge before and after this training. It's still available if you happen to still want to fill that out and haven't yet. A lot of people, we have 34 people I think already signed up for our Google group, and that's great. That's going to be an online ongoing community, so it helps us have email discussion. And so if you want to provide an announcement or question, you can do so through that Google group. It's open and available now. Don't be shy, nobody's posted but me yet, but you can. You would just accept the invitation that Shasta sent to you. Make sure it didn't go to your junk box. That's happened to a couple of people. We've also heard from people that they've tried to accept the invitation but couldn't, in which case maybe you're blocked by your organization. You may benefit from trying to set up a tie between a Gmail address and your work email. And so there's instructions for doing that. If you are struggling, please just reach out to me and I'll help you through it and we'll get you logged in, okay? So I did want to focus on our suggested reading. Last time when we closed out, we said every time we close out a webinar, we're going to just suggest a reading for you. We had asked folks to look at the second chapter of the 4th National Climate Assessment on Our Changing Climate, which does a good job of setting some basic scientific understanding of what's going on with the climate and what's changing in the atmosphere. And I just wanted to take a moment and encourage a chat discussion here to talk a little, to just share your thoughts in the chat box. What did you read about that surprised you? And it could be real short, just something that you didn't know or might be really applicable for your community. What did you learn? And we'll read a few of those out. And as you're doing that, I will note that also since our last webinar, the big news in the climate space has been that July was the hottest July on record. And Shasta, did you hear also that there's a whistleblower at CDC that we have actually worked with? That yeah, whistleblower that's doing climate and health work, who's making sure that he's able to speak out about some of the suppression of climate and health science. So it's a real, I mean, this is a controversial topic still in some communities and some places. So we understand that if you're a community that not everybody is bought in on climate change, we're going to give you some, at least resources, so you can share some evidence and information. All right, do we see any chats?
Well, I started things off, but with putting my own without being super specific. I've read this portions of it before, but my aha moment in the assessment was that there are some effects happening that I wouldn't have considered as being linked to climate. And actually, in particular, some of these health effects that we talk about, you know, it was a big surprise to me the first time I considered that climate was going to have an effect on something like chronic obstructive pulmonary disease, not something I would have considered. So that's a surprise. So you find out things that you never would have thought, and it can be scary, but then it's good to know that people recognize it. And I'm not seeing any other chats just yet. You know, folks on your right-hand side and your toolbox over there, there's a chat box. You might have to hit the little drop-down arrow to make it show up. So if you want to type anything in there, we can share it. But so far, looks like everybody is still drinking their coffee. And
That's okay. Well, why don't I kind of walk through these graphs on the right? This came out of that chapter 2, our Changing Climate of the 4th National Climate Assessment, and it's establishing the science of what's going on in the atmosphere, what's changing in terms of drivers of climate conditions. And so a lot of people want to separate out what might be human influences versus natural influences. So natural influences on the climate include things like volcanic changes, solar changes, orbital changes, and those do fluctuate, as you can see on the top, but it's more the yellow line, and they're relatively staying stable. The evidence presented in the 4th National Climate Change separates out human influences, which includes greenhouse gases, ozone, land cover, and aerosols, and really just is showing the strong correlation between the increase in greenhouse gases and the temperature difference on average globally. And so that's sort of one of the basic fundamental pieces of understanding in climate change, and something good to have in your back pocket if you ever need to have some of that handy to you in your community. Any other comments on the reading?
I do see a hand up. Hold on a second. Erin Berry has her hand up, so I'm going to unmute her for a moment to see if she wants to join in. I'm trying to unmute her, and there we go. Erin, did you have something you wanted to comment on? Maybe she raised her hand by accident. Oh wait, now she's got a question. Let's see. She says, oh, sorry, accidentally. Accidentally hit the button. You know what? That's like the story of my life. But we do have a comment here from Amber Neshoba where she says, Arctic climate change is really apparent in Alaska and that the smoke from fires is really bad in Anchorage. So I assume that means fires that are going on right now. And I also just got an email that said the chat box isn't working. So folks, why don't you just, since the question box is working, you can put your comments in the question box and I'll make sure that those get read out.
Wow, we're sorry about that.
Yeah.
Okay, well, thank you. I do have a poll just to wake everybody up, and I'm just curious here. I'm going to launch this poll for us. It should pop up for you. And the question is, do you work in a community that would find the information that we're talking in this chapter that we just sort of summarized? Would that be a controversial thing in your community? Yeah, so yes, no, or don't know. So we'll just give you a minute to finish up your poll. All you have to do is click one of those boxes, and then we'll go ahead and close it in about 10 seconds. We'll launch the results. Pretty cool instant polling feature here.
We're up to 77% voted. Come on, you last 23%. We have faith in you.
Come on, caffeine, start kicking in. All right, I'm gonna go ahead and close it. This is good. Oh, we got some more. All right, and I'm going to close. And let's share the results here. Okay, so it looks like 10% of you think that yes, this is a controversial topic. 62% say no, and 29% say they don't know. That's actually fewer yeses than I would have thought. But so as we continue along, so we're going to dive into the topic of what is climate change. We're going to present some resources and some evidence that you just put in your back pocket in case this is something that you might, in your work doing climate change, need to establish a basic understanding for folks.
And Angie, we do have another a question related to the chapter. This comes from Normalinda Sydney. And she says, I see the term climate sensitivity in the article. Can you explain this further, or is this considered a buzzword?
All right. Good question. I have to go back to the article and see if they define it somewhere, what their scientific definition is. I would assume it's talking about the climate, how sensitive the changes are in the climate to the emission and other influences changing in the atmosphere. But let me go ahead and look at that for you.
Yeah, and I think also climate sensitivity, I think Angie is correct. It does refer to the region that you're talking about. Is it more sensitive to some of these climate changes than others? So we know that in Alaska, for example, as Amber pointed out, that this is the front lines where their ecosystems are more sensitive to climate changes and are experiencing them more quickly.
Okay, so we're going to move into what is climate change. This might be very elemental for some of you, but climate change refers to long-term changes in usual or expected weather patterns that are driven by elevated greenhouse gases. So weather is more what you get on any day to day. Climate change refers to long-term changes in expected weather patterns. And so, you know, greenhouse gases are not a negative thing in general. Life on Earth actually depends on them and is shaped by and affects climate. So our livelihoods have a lot to do, a lot of dependencies on various aspects of the climate. And I like this picture because it really shows how thin the Earth's atmosphere really is. It's only about 60 miles thick.
And actually, we're not seeing the picture at the moment. We're still seeing the poll results.
Sorry. Thank you. I'm going to hide them. Is that better?
There we go.
Sorry about that, guys. All right. So the picture here is of obviously Earth, and you can see the thin layer of atmosphere that's about 60 miles thick, and our diameter, the Earth's diameter, is actually about 8,000 miles thick. And so most of that atmosphere, the content of that atmosphere, is happening within the first 10 miles of the surface. And Shasta has a good analogy for that involving an apple. Do you want to share that?
Yeah, so if you were to think of the Earth as being an apple and the atmosphere as being its skin, this would be an apple whose skin is actually 100 times thinner than an actual apple's skin. So even an apple skin is 100 times thicker around the apple than the Earth's atmosphere is around the Earth. So it's a very, very, very thin boundary around our planet.
Right. Some people think of the atmosphere as being this boundless, endless, giant space. But we can actually have some impact on it. So it is composed primarily of nitrogen and oxygen. Only about 0.04% is the famous carbon dioxide that you hear about all the time, which is one of the primary greenhouse gases, and far less is methane and other sources of greenhouse gas emissions. So that's just sort of the composition. So what is climate change? Folks have probably heard about the greenhouse effect. Greenhouse effect is really important. The greenhouse effect is when the sunlight passes through the atmosphere and warms the Earth's surface. So it acts like a blanket. It naturally traps the heat into Earth, and that's what helps sustain life. So these greenhouses are a really important and good thing in the right balance. So what's happened in recent history is a change in the level of carbon dioxide and other emission levels versus what they have been historically, at least during human history. And so in the last 10,000 years, records show that before the Industrial Revolution in 1751, carbon dioxide levels in the air had risen by 10%, so over 10,000 years. Atmospheric concentrations of CO2 since pre-industrial times have increased more than 40%. So that's in the last couple of hundred years. And it went from 280 parts per million to over 400 parts per million. And in fact, there's news all the time that we're hitting new record highs of parts per million of carbon dioxide in the atmosphere, higher than it's been for 800,000 years. And so, like we said, there are some natural causes for some climate fluctuation, solar radiation, volcanic activity, but none of them correlate well enough to explain the rapid changes in our climate that we're experiencing. And so human activities, on the other hand, we know that we release about 30 billion tons of CO2 in the atmosphere every year. A lot of that's through fossil fuel combustion, which accumulates over time. So we have like what some refer to as a carbon bank, and so it sort of accumulates. It doesn't necessarily dissipate or go away, so it's accumulating over time. And that's the impacts of that are exaggerated by our continued deforestation. Forests would be a natural sequester or something that would absorb the concentration of CO2 back out of the environment. And so there's all sorts of ways to look at evidence for climate change. I really enjoy using NASA because everybody knows NASA, and NASA has a great website where they are showing all sorts of metrics for how we know climate is changing. And so they look at, primarily the big indicators, global average temperature rise. And so like we said, July was a historical record. The second below that, basically the highest 5 Julys have been in the last around 10 years. We have seen a 1 degree Celsius increase in global temperature since pre-industrial times, and that is exaggerated further in the Arctic, where they're seeing 2 to 3 times higher. I think my little video here on the right might be playing, and this is just showing actually changes in sea ice extent over the years. And so you just see it's coming and going, but over time dwindling pretty significantly. Other indicators are warming oceans, rising sea levels, shrinking ice sheets, declining Arctic sea ice, glacial retreat, an increase in trends of extreme events, ocean acidification, decreased snow cover. These are all things that scientists look at and are able to establish trends over time to see how things are changing. One other thing I did want to point you to was this page. So since we're going to be talking somewhat about the National Climate Assessment, and that's so supported by an organization called the United States Global Change Research Project. And if you ever need some really good statistics or some charts or just a place to send people on finding some data behind the metrics we talked about, this is a good place to go. So, for example, if you want to just go in and look at, say, glacier mass balance, it gives you a nice little summary and some key statistics about what's changed over time. And so it's a good resource to go to if you're looking to establish, if you're looking to establish the case for climate change is happening. All right. So in our world, in the Tribal Climate Health Project, we took a lot of information and we synthesized it and we came up with our own strategy for how we like to describe what climate change is doing to us. And so it's really important to, when we look at the science, to realize that there's a cause and effect relationship between a lot of the things that are happening in the climate. And so we call certain things drivers. Drivers are the greenhouse gas emissions that are on the increase, which interact with the greenhouse effect and prompt climate change. Climate change is resulting in a set of exposures. Exposures for us mean something that our community might be exposed to that's happening in the climate we might not necessarily be able to control for. For us, we have boiled those down to 5 primary exposures: temperature extremes, wildfire, storms and flooding, drought, and melting ice and sea level rise. And in the next several webinars, we're going to tick those off one by one and talk about the cascading effects of those exposures on our communities in different regions. We know that there are secondary exposures that are resulting from those primary exposures and that there's a lot of relationships between them. And so the secondary exposures we talk about include worsened air quality, vector changes, so mosquitoes, ticks, rodents, water insecurity, and food insecurity. And from there, we know that those cascade down into impacts. Those impacts are things that come into contact with our community that are going to affect our natural environment, built environment, and health and social environment. So for this training, we're obviously going to focus primarily on health and social. And the whole goal of all of this is to understand the things that are coming to us so that we can prepare with strategies that are geared to protecting the things that our community values. And so what does climate change mean specifically for tribes and indigenous people? Well, there's a lot of literature about tribes as being frontline communities, and that's certainly true. Tribes are an enormous stakeholder in the beginning of the effects of climate change. Tribes manage and protect and restore over 110,000 square miles in the United States of land, and tribes are no stranger to having to adapt to change, whether it had been historical trauma, settlements, ecological changes, and now climate change and urbanized development. I do want to show you a quick video that I think does a very good job from a tribal perspective, talking about in general what climate change might mean for tribes. Before I do that, I just want to reiterate, while I know that tribes are usually considered uniquely vulnerable, and we hear about all that, a lot in the literature, we at the Tribal Climate Health Project certainly believe there's a big case to be made that tribes are also uniquely resilient, and there's a lot of good assets, a lot of good practices that are happening in tribes that can help tribes stay strong. But let's go ahead and watch this video.
I think before I can even talk about climate change, it's worthwhile to understand the chronic and debilitating socioeconomic conditions that are prevalent in Indian country. And when I mean Indian country, I just don't mean the lower 48. Includes Alaska Natives, but also Pacific Islanders and the Caribbean Islanders as well. And then when you overlay the impacts of changing climate, that exacerbates those conditions and really puts those indigenous populations on the short end of the stick. So for example, you take Alaska Native communities that are almost solely, in order for transportation, it's either very traditional methods, so either ocean going, canoes, or on foot, and snowshoes, and in some cases snowmobiles. And it's difficult to maintain that subsistence lifestyle when the changes are impacting the food resources like marine mammals, or permafrost is thawing, and so access to traditional homelands for caribou or for moose are impacted by varying seasons. You're starting to see earlier thaws, so the timings of hunts and gatherings are impacted, and so consequently, what may have happened this month in years past now has to be bumped up, in some cases a month earlier. And so we're starting to see a change in how we interpret the environment around us.
All right, so I enjoy that video. I think it does a good job providing high level sort of thoughts. To get us started, how are these climate changes really going to affect our communities, so in tribal communities? So when we, I think when we talk about tribal communities, we certainly have to recognize and acknowledge the specific impacts on livelihoods, economies, and that can include agriculture, hunting, gathering, fishing, forestry, energy, recreation, tourism enterprises that could all be affected, and I think uniquely in tribal communities. And so as we know, climate changes and its effects are already being felt by tribes all over the country, and that ranges from extreme heat, and we know that that's affecting the Pala community, where Shasta is literally probably right now. It can include drought, sea level rise. So these are a couple examples of communities that are really already feeling some very devastating effects of sea level rise in their communities. So Ile de Jean in Louisiana, and this is a Cavalina village in Alaska, both at risk of potential displacement, resettlement, and relocation. And so we will talk about the impacts to tribes of climate change in the context of federal laws, treaty rights, sovereignty, and self-determination, because all those things are potentially at risk from the impacts of climate change, especially for folks that may be having to relocate or resettle, which is obviously a very complicated, burdensome process. And even for folks that don't have to resettle, there's oftentimes many institutional barriers for tribes to doing the adaptation practices that they know may actually work really well for them. But for example, they may have some federal laws impeding their water management practices or hunting practices, or they may have limited options to adapt on their small landlocked areas in terms of migration and movement. And then finally, we want to just point out that we hear from tribes that we work with all over the country that engagement, consultation, and consent are extremely important and maybe not happening as much as we'd like on the climate change and adaptation front, but that's getting more and more important as changes occur and adaptation strategies are needed. And so, as we move into the conversation about health, the human body, human health, there's going to be a lot of similarities between tribal communities and non-tribal communities, but there are some specific climate-driven health challenges for tribes. While every tribal community is unique, we do see that oftentimes there are disproportionate health outcomes already in tribal communities, so things like higher asthma rates potentially, or chronic conditions, and climate change is expected to exacerbate those disproportionate health outcomes. For communities that are dependent on their own food and water sources, water and food insecurity are an extreme hazard of climate change. Even for folks that are not reliant or might be more urbanized tribes, we're seeing mass and potentially global changes in water supply and food markets. The loss of ecological health can mean loss of livelihoods for folks that are maybe doing timber or other agricultural types of enterprises. Relocating may mean loss of culture, community, and rights. And then we often hear, and we'll hear from a health practitioner in a few minutes here, that public health services for tribes are already potentially underfunded. And so the need is going to increase, and hopefully the services do as well. And so we want to take a moment here just to talk about what is health and well-being. And there's some differences here. In our advisory group, when we developed this curriculum, we heard from a lot of folks that, obviously Western and tribal communities define health very differently. And in the tribal world, there's all sorts of definitions of health that are different within the tribal world. And so, for example, one of the ways that the Swinomish tribe defines its health is through what they call their indigenous health indicators. And their metrics for what is considered a healthy community include self-determination, cultural use, natural resource security, resilience, education, and community connection. Those are values that their community knows is integral to their overall health. The Alaska Native Tribal Health Consortium has a different take, more of a public health view of health, where it talks about providing whole person health services and medical care, preventative wellness programs, rural community infrastructure development. And so that sounds a little bit more like a public health infrastructure. And so it runs the gamut. I want to tell you a little bit about how we define health within the Tribal Climate Health Project and how we're going to organize the content that we present to you. So we define health more broadly than the absence of medical disease, which is oftentimes what you hear in some of the Western publications or literature. So we have a section for human health. So that would include physical and psychological health. But we also have a section for spiritual and cultural health and socioeconomic health. And so those are the sort of sub-elements of our social and health environment. But we also want to tap into the idea that health is dependent upon elements of both the natural and built environment. So we know that tribes consider their health very interconnected and dependent upon social and ecological systems. And we know that those systems are being disrupted by climate change. And so I just want to share a few frameworks that come out of some of the national literature. This diagram on the left is from the CDC, and it just does a good job of, at a high level, showcasing some of the health impacts of climate change. And as you can see, they're sort of cascading out. So we really like when diagrams show relationships. And so they're talking about some exposures like rising temperatures leading to some things like water and food supply impacts, and those things having health impacts, including basically an increase in human health threats like illness, injury, death, trauma. And we don't want to forget other mental and psychosocial consequences. And so in this training, when we talk about human health, we are going to include mental health and well-being within that framework. And so the United States Global Change Research Project is really clear about its key findings with its climate and health assessment. It says there's going to be increased exposure to extreme events and coastal flooding that will affect health. Not only that, is there going to be direct impacts, but the disruptions of those events to essential infrastructure can limit access to healthcare and emergency response services. This is a fun diagram I just came across this past week that comes out of the Medical Society Consortium. So I'm trying to present, because I know a lot of you are environmental or sustainability professionals, trying to present some things that are coming out of the health world, because there is a lot of information emerging. People are getting serious. This just does a good job of trying to diagram by region where certain health impacts are expected. I like it. Feel free to use it in your work. So it's ranging from extreme events to water-related infections and wildfire. It's based again off the United States Global Change Research Project information. I see some gaps here actually that I would change, but I do think it's a nicely laid out diagram and does a good job. So you can actually just look at your own region and look at the legend there and see, you know, at a high level, you get a snapshot of the types of things that might be coming your way that you will want to prepare for. Just a couple more frameworks. These are coming from the National Climate Assessment as well. And so what I like about the diagram on the left is that it does a good job outlining some of the mental health impacts of climate change, including stress, substance abuse, post-traumatic stress disorder, and community health. So on a community scale, what changes are we seeing? Anything from violence and crime to decreased community cohesion. Those are all, for me, very, very integral in overall community health. I do want to point out a lot of times it's really important to consider vulnerable populations when we talk about health, because all that means is that there are some populations that are going to be more sensitive to some of the climate impacts than others. And we hear in the literature all the time, sometimes they lump indigenous communities all together as being vulnerable. But within tribal communities, you'll want to know who are your most vulnerable populations and who you might need to provide extra protections for. And so older adults, maybe you would refer to them as elders, children, and folks that are lower income. Those are often cited as folks that are more vulnerable, and also people that have pre-existing physical or mental health conditions. There is good news, and that's why we're here. This is a, this is a hopeful training, so there are things to prepare for, but I really like this quote from a Alaskan adaptation plan, and it just says, through adaptation, negative health effects can be prevented. What good news. So if we do nothing, we may not have as much chance of eliminating some health effects, but there's a lot we can do to minimize those. And so adaptation as a word, I mean, that might be new to you, is the process of taking actions to reduce or manage risks associated with climate change. And so just to take a quick moment in the chat box or the question box, perhaps if that's working better, if you can just chime in and let us know what's kept your tribe from acting on climate and health threats. Or if you are feeling very eager to answer this question, you can raise your hand as well. We'll just take a few seconds here and let you enter anything into the chat box you wish to share or the question box you wish to share. You probably are very aware that these climate exposures and impacts are occurring, and you're here for a reason, because you probably want to make faster progress on an adaptation, but what's kept you from doing it, especially when we're talking about health?
Well, I'm monitoring your chat box, I'm monitoring your questions, so you can use either of those, or again, raise your hand. But I'll volunteer that what has stopped me, I've got a lot of stuff going on, so it's hard to decide what's going to be the biggest priority. And we now have a response here from Noah Saperstein. Sorry, Saperstein, Noah. I'm sorry if I got that wrong. But he brings up something that's important to all of us, I think, and it's a lack of staff capacity we need more people, he says. And I think Noah is in the Red Cliff band in, I want to say, Minnesota. Noah's probably on the other side of the computer going, no, Shasta, you don't know what you're talking about, so please correct me if I'm wrong. But I think that's true for most of us. We have a lack of staff capacity. And
Yep.
I'm not seeing any other hands at the moment, but again, feel free to just throw your thoughts into the chat box. What are your barriers to starting on the climate change adaptation? Oh, sorry, I'm being told Red Cliff is in Wisconsin. I apologize for my terrible, us California people think there's nothing but California. And then we have Jaime Yazi. She says something, this is important, funding and historic tensions between federal agencies and tribal governments and communities. And that's an incredibly important observation. So Jaime, thank you for that.
Now I'm going to look for a volunteer. Somebody either from climate, sustainability, or health, or emergency professions. I just want to kind of spotlight a trainee and talk through these questions. And I'm looking for a volunteer, somebody who could answer, just tell us what kind of professional you are, what your role is in addressing climate change, how prepared you are to assess environmental and health information, and how your profession typically makes community planning decisions. So this will just help us all, because we're going to transition into talking about how different professions sort of tackle climate and health.
And while we wait for that volunteer, you can raise your hand if you're a volunteer. But we have from Norma Linda Sydney, she says, as somebody from Arizona, heat is heat, but we see everything change around us because of the extreme heat, and there's a lack of data around that. And also from, oh, Sunny, I'm going to get your name wrong, so I'm just going to say Sunny Sunethra Wijasingh, and I'm sorry, I know I probably butchered that, but she says it's not always easy in tribal communities to convince the tribal authorities to take action. And then we have our ITEP Tribal Climate Change Program talking about barriers, getting it done, and no support. And I'm not seeing any hands getting raised, but I do, there's my hand. I was going to say I'm going to unmute our ITEP Tribal Climate Change Program because she's right on the other side of the wall from me. So hold on just a second and I will let you introduce yourself. Go ahead.
Can you hear me, Shasta?
Yes, hi Nikki.
Hi everybody. My name is Nikki Cooley and I'm from the Navajo Nation. And so do I just go ahead and answer all these questions? Yeah?
Please.
Okay, I promise not to talk too long. I think I'm a scientist. What kind of professional am I? I'm a scientist by training, but also I'm a indigenous scientist. And I'm an educator. My role in addressing climate change is that I go around the country to tribal nations and talk about climate change impacts and just kind of, I think it's nice for people to hear from somebody sharing experiences from different areas of the country, including Alaska, about what they're going through, that it's very similar to what Noah in Wisconsin is going through, for example. So that, I mean, and then also talking about my own personal story from growing up on the Navajo Nation. I know that Jaime Yazi can probably also speak to that. Number 3, how prepared am I to assess environmental and health information to aid in adaptation decision making? Well, I am very lucky because I'm surrounded by amazing people like those from Pala, from and like Angie and Josh and so on. So I feel pretty good. Like if I were to do this in my own community, I know what the tools are, where the tools are, and who to go to. But I'm very lucky because that is part of my job to learn that. But I think it would be scary though if I were just doing it all by myself, as a lot of you are doing. How does your profession make community planning decisions? So, well, I have all of ITEP and I have Shasta. And Yeah, I mean, we have to do teamwork. Otherwise, I really feel like our work, even our climate program, would cease to be productive and whatnot. So even though we may disagree on stuff, we all have to come to some sort of consensus to move forward and whatnot, but also acknowledging that we may not agree on some things and whatnot. So, and with that, I will pause or stop. So thank you.
Thank you, Nikki. Thank you, Nikki. That's just sort of a precursor to introducing the idea that there are multiple ways to go about health and climate and health adaptation. There's a public health planning approach. They have their whole world where they do community health assessments and improvement plans. There's a climate adaptation planning approach. We're going to kind of focus mainly on adapting that for health, where you do a vulnerability assessment and an adaptation plan. We're going to talk a lot about that over the course of the next few months. And then an emergency management approach. So you might have folks within your tribe that focus on emergency management, and there are a lot of ties to what goes into a hazard mitigation plan and an emergency management plan that can really feed in and inform your climate adaptation efforts. And so there's a lot that public health or health professionals can do to support climate adaptation. A lot of it is it could be outreach, it could be policy, it could be community partnerships. A lot of it, though, is an assessment and surveillance of important indicators and data. And so I want to go ahead and actually just take the moment to pass this off to our guest speaker, Vanessa Crissy, who is here with, she's the interim director of the California Tribal Epidemiology Center, which is funded in part, at least, by the Indian Health Service. And so it's part of this overall tribal health system that all of the tribal communities have some relationship to or access to for tribal health. And so I'm going to hand it off, and she's going to talk to us for about 10 minutes.
Great, thank you, Angie, for inviting me to this webinar and talk a little bit about what we do. As Angie mentioned, my name is Vanessa Crissy. I'm the director for the Research and Public Health Department at the California Rural Indian Health Board. And within the department, we house the California Tribal Epidemiology Center. I'm originally from New Mexico. I come from the Navajo Nation, but I've lived in Sacramento area now for about like 14 years. So the Tribal Epidemiology Centers were established by the Indian Healthcare Improvement Act. And originally there were 4 tribal epidemiology centers, which I'm going to call TCHs for short, started in 1996. And now there are a total of 12 across the United States. We do operate independently of one another, but we're also come together on common issues. And all the tech directors convene twice a year to address issues that may be of value to all of us and how we can better support tribes and tribal communities in our areas. So this is a map of all of the service area of the TCHs. So you can see us here in California. We do serve just the state of California. We are located outside of Sacramento, but there are, I'm sure you guys are across the United States. So depending on what state you live in, you'll see that there is a tech that has been created specifically to assist you in the work that you're doing. So TCHs were also, like I had mentioned before, they were created by federal legislation, but also they were considered and designated as public health authorities, and that designation was given to TCHs through the Indian Healthcare Improvement Act when it was reauthorized in 2010. And so as a public health authority, all of the TCHs have access to the Federal Health and Human Services data system and also information that they may have. And from that, we could be able to conduct public health surveillance and utilize data that can better support or assist the tribes and the tribal communities we work with. And also it was indicated that each IHS service area must have tech access. So as you noticed in the map earlier, we do serve the whole country. We do, all of the techs have to conduct what's called 7 core functions. So initially we received funding from the Indian Health Service through their division of epidemiology. And it's through that they helped us build a foundation of all the work that we do. So some of the activities and support that we offer to our tribes and tribal health clinics and urban Indian health clinics are related to these 7 functions, and they include things like collecting data, evaluating data, and maybe evaluating the programs, identifying health priorities. We do that through we do that through community health profiles, or maybe conducting community health assessments with our tribes and clinics. We make recommendations for health service needs, for improving healthcare delivery systems. So that could be through comments that we provide to the federal government on policies and procedures that they may be wanting to implement. We also provide epidemiologic, and I would also include evaluation technical assistance to tribes and tribal organizations. We also provide disease surveillance to tribes. So since the beginning of when the techs were formed, all of these core functions are things that we really try to enhance and also to provide to those that we work with. So what does climate change look like? And Angie did mention that, and I'm thinking about this in more relation to California and what we've been hearing and experiencing here in California tribal communities. And it's also different across the state because the land is different, the food is different. And so with that, there are unique challenges to different parts of California. So some of the things that we've been experiencing are, droughts are longer, they're more extreme. A lot of the coastal people are noticing that the ocean water is warmer. The sea levels are rising. Wildfires are more frequent. We deal with that often. Increase in vector-borne diseases. We've seen more floods where parts of a community's mountain has, flooded, and because of the flood, there has been some damage, and it limits people's access to their communities or even to be able to leave. We've seen that all of this has effect, for example, the salmon population, tribal communities being able to grow and utilize acorn the way they used to have with how they've been used to using acorns. We've also seen invasive species in trees and plants that some of the tribal communities use and rely on for basket making. So these are all the things that are affecting tribal communities and more. When I looked at the Karuk Tribes project website, they show that, how climate change has been affecting them. And their quote is, the fire affects the plants, which affect the water, which affects the fish, which affect territorial plants and animals, all of which the Karuk rely on for cultural perpetuity. So we can really see that this is impacting tribal communities. And so now I'm going to turn it over to Nino. He is one of our epidemiologists here in CTEC, and he's going to talk a little bit more specifically about the work that they can do with tribes and tribal communities in clinics. Al?
Shafley, you need to unmute.
Hello?
Oh, there you
Okay.
go.
Hi, can you guys hear me? Hi. Yeah, so again, I'm Nino. I'm an epidemiologist here at CTEC. And I will be going over how CTEC can help and service your environmental health needs and provide you with some potential environmental health data sources and health indicators. So how can CTEC help? That's through the collection of data. That's through survey administration or environmental health specific surveillance. Evaluate data and programs. Identify health priorities with tribes, as Vanessa just stated. Those are typically through usual community health profiles or community health assessments. But in order to cater to environmental health specific needs, we will be conducting vulnerability and risk assessments, make recommendations for health service needs. These are again based on those vulnerability or those risk assessments that we would conduct. Make recommendations for improving healthcare delivery systems, provide epidemiological technical assistance to tribes and tribal organizations, again, more environmental health specific and climate change specific, and provide disease surveillance to tribes. Again, these are more specific to vector-borne and zoonotic diseases. As we try to increase our capacity for the next project year, we're hoping to increase our capacity for more vector-borne and zoonotic related disease surveillance. Next slide. Thank you. And instead of listing general, broad websites and environmental health data sources online, we wanted to provide you with a list of specific health indicators associated with climate change. Now, these are at the national, state, and county levels that we can provide, and we can provide more analysis on based off of these public online health data sources from like the CDC, California Tracking, CDC Wonder, CDPH, and CalAdapt. So these specific health indicators do include vector-borne and zoonotic diseases, so mosquito surveillance, that includes West Nile virus and Zika, hantavirus, and tick surveillance. Now, this also includes Lyme disease, Rocky Mountain spotted fever, and tularemia. We can also provide analysis on asthma rates. Asthma rates related to emergency department visits and hospitalizations, and related deaths, again related to asthma. And finally, heat-related illnesses. So these include heat stress hospitalizations, ED visits related to health-related illnesses, heat exhaustion, and heat stroke. If you require technical assistance, there is a request form that we have online. And basically, you would access the request form through that link there, fill out the request, and that gets sent to our outreach coordinator, who then forwards it to the appropriate staff. So the appropriate staff for any environmental health or climate change related technical assistance will fall under myself or Kelly, who was not able to attend the call today, but we're here to assist. So Vanessa, you want to take it from there?
Actually, Vanessa, before you do, oh, you know what? Never mind, because you're about to wrap up and ask questions. Okay, all the questions. So go ahead, Vanessa.
Yeah, that was just a list of all of the tribes and tribal health clinics and urban Indian clinics that we have data sharing agreements with in California. And so for those who are outside of California, I strongly encourage you to make connections and develop relationships with your own tribal epidemiology center, because depending on where you're at, they may have more specialized surveillance capacity than we do, given that we may not be experiencing the same types of illnesses or diseases that you may be. And I'll be happy to connect you if you need some connection.
After the webinar, we'll follow up and we'll pass along contact information for these guys. I love the CTech folk. Thank you guys very much for presenting. The reason we wanted them to come today early on in the webinar series is because we've overwhelmed you with a lot of high-level climate effects. And we want you to know that there's health muscle available to you if you don't feel like you have the internal capacity for some of this stuff. And we're going to go into a lot more detail in upcoming webinars about data, how to analyze it, where to find it, where to use it, in what order, so don't feel overwhelmed that this was a lot at first. I just want you to take away that there's a lot of good information available to you and some support. Okay?
I know there was a question from the in the chat that I go ahead and answer. And the question was, can you clarify, is this data from IHS healthcare systems being pulled together into a centralized database, or is it independent data that the techs are collecting? Actually, there's both. So depending upon what type of data you're looking for, some of the data sources could be within your state or within your county. If you want specifically to collect data within your tribal community or within your clinic, we could assist in that and help you to collect data specifically for your area. California Tech has access to what's called an Epidata Mart. So that is encounter data and patient registration data from the Indian Health Service tribal health clinics. And so from that, we could look at, for example, asthma rates. That would be one way we could look at it. We don't look at necessarily diagnosis. We only have access to encounter data and patient registration data. And so if we do work with any of a particular tribe or a consortium of tribe, we don't necessarily publish that information. We do support in any way we can, and whatever the tribe or the clinic chooses to do with that information and data, that's up to them. We don't necessarily post anything on our CTEC website.
I am committed to getting us out of here on time. I want to again thank Vanessa and staff for their presentation. Thank you so much. That was helpful. And thank you all for being part of our training community. This wraps it up for webinar 2. Our next webinar will be in a couple of weeks on September 3rd. That will be on an introduction to the changing exposures and the impacts. So we're going to dive in on each of those exposures and talk about the impacts that may be coming to you. And we're going to start with temperature extremes. And so one last thing is a suggested reading for you to complete before the next webinar. And we just invite you to pick one chapter out of the climate and health assessment that was produced again by the United States Global Change Research Project. And so this is one of the premier national documents about health impacts of climate change. So pick a chapter from 2 to 8. And they're on all sorts of different exposure types. And so whatever seems most relevant for you, please take a gander, and we'll talk a little bit about it when we start next time. I think that'll wrap it up for today. Contact us anytime, and we will be in touch with follow-up information. Thank you all.
Thank you.
Thank you.
Thank you.
Thank you.